Hey everybody, it's Leila, Health Education Manager here at AI Arthritis, and back to give you some takeaway points from a few sessions that I watched this morning. The overarching theme is going to be reproductive health, fertility, and all of that good stuff, breastfeeding. And so I actually have talked about this subject a lot in the past year. I've reported back from the Rheumatology Nurses Conference last August, a little bit from ACR, as well as I did a talk show episode on this topic. So there will definitely be other resources for you to take a look at on our website if that's something that you're interested in. There's a few different podcast episodes that are about this, but today mainly is going to be an update on the recommendations and any kind of new medication updates that there are, because there are so many different medications that are used to treat our diseases. There's a lot to keep track of what is pregnancy safe, what is safe for conceiving, what is safe for lactation and breastfeeding. So, there's a lot going on. Always new studies seeing whether or not these medicines can be safe in those different situations. So I'm going to read out some of the overarching principles when it comes to reproduction, pregnancy, and breastfeeding. And so all patients, male and female, should be offered early and regular counseling about reproductive health. We hear a lot from patients that, my rheumatologist has never even brought up family planning to me. How do I bring up this conversation? Do I talk to my gynecologist about it? Do I talk to my rheumatologist about it? It does need to be offered, once someone gets to childbearing age, if they are a woman, or, just in adult life for men. It should be brought up in conversation to see, what the plan is, and so that patients are aware what could happen on their different medications, or what needs to happen in order for them to be able to safely carry a baby. And then treatment of patients with rheumatic and musculoskeletal diseases before and after pregnancy should aim at remission or low disease activity. So you may have heard this phrase talked about several times. I talked about it in my lupus session or in my lupus debrief, but treating to target, having a target in mind and knowing exactly what is, sought after, so that the team can help and treat to that target and, do what needs to be done with the medications with that goal in mind. The next one is potential risk of drug therapy for a fetus should be weighed against the risk of untreated maternal disease. So there's this dance of okay, there's a chance that this could break or could pass through the placenta barrier and passed on to the fetus or to the child. But there's an even higher risk that the mother is going to be in really bad shape with her disease if we don't use this medication. So it is a hard decision to be made, but definitely should be, discussed and so many different individual factors taken into consideration. Next is, given the benefits of breastfeeding, women should not be discouraged from breastfeeding while taking compatible medications. So that's the biggest thing too, is that with breastfeeding, it's different, something passing through the placenta, those molecules passing through the placenta, there's a barrier there. But with breastfeeding, is this molecule going to pass on to the baby? And how much of it, is it going to be concentrated? Is it going to be enough to suppress their immune system? If that's what the goal is for the mother, is enough of that molecule passed on to the baby to the fact that it's going to affect them physically, affect their immune system, anything like that. Those are all things that need to be taken into consideration. And lastly, the last overarching principle for this is the choice of treatment before, during, and after pregnancy should be shared decision-making process between the treating healthcare providers and the patient. And notice it doesn't just say rheumatologist. Gynecologist or OB should be in the conversations for this, as well as any other specialists. They do talk a lot about having, high risk OB or gyno specialists to hopefully look for in your health system to be on your team if you do plan on, trying to conceive. Having a high risk, someone who's specialized in high risk can be very beneficial. And so I'm not going to talk too much about the specific drugs that can be used before or during pregnancy or during breastfeeding. I'm going to make sure that the charts that were in the PowerPoint will be shared with you as well, so that you can see the individual names of the medications to double check if that's something that you are interested in looking at. So I'm going to make sure that I have those slides included. But for some, just to look out for men specifically, cyclophosphamide is a big no-no when it comes to wanting to conceive or wanting to be able to conceive. So that is something to be careful of. If you are on cyclophosphamide, you want to talk to your doctor about the risks of that and how to get off and what to change to in order to make sure that the baby that is conceived is healthy. The other teratogenic drugs are methotrexate and mycophenolate, which are very commonly used as well. So cyclophosphamide, methotrexate, and mycophenolate are going to be the big three that you want to make sure to discontinue before pregnancy for women, and cyclophosphamide specifically for men before attempting to conceive. The other thing that they're very iffy on that they talked about is JAK inhibitors, that there isn't enough data to make a assumption on what is safe or not, but to err on the side of caution when it comes to that. Overall, I think that the biggest theme here is making sure that rheumatologists and other professionals are talking to their patients about birth control if you do not want to conceive a baby, making sure that you are taking those steps to make sure that you're still being safe, because when it comes to your own disease, something like pregnancy can cause your body to react in a way that could be detrimental to health, and just want to make sure that that is being taken care of and being talked about. It's a little weird, right, for rheumatologists to talk about birth control, but it really is having to do with that disease. So it is important. Next thing is to know that there is a lot of psychological and emotional aspects when coming to family planning with these types of diseases, something that we have to be very cognizant of for patients, because it's very emotional. A lot of people may not understand what you're going through and why you have to be so careful about things, and all the added anxiety when it comes to family planning. There's already anxiety, and on top of that, having to figure out what to do with the different medications, it can all be very hard on the patients mentally. And again, making all decisions with shared decision making and having those collaborative conversations with healthcare professionals and advocating for yourself. I talk to my rheumatologist every single time that I see her about our plan for me to eventually be able to conceive. It's been in the works for 2 years that I've started to talk to her about it, and starting to get off of my mycophenolate, starting to get off of the different medications that could be detrimental to me wanting to conceive eventually. And yeah, that is it. If you have any other questions, let me know. Like I said, I will make sure that the slides are included so that you can see what is compatible and what is not compatible with the different stages of reproductive health and the different medications. And yeah, I hope that you all are enjoying these takeaway debriefs, and I will talk to you in the next one. Bye.